If your trauma doesn't look like constant breakdowns or panic attacks, but more like big reactions, shutdowns, or people pleasing that you don't fully understand, I built Trauma Science Academy to give you simple, non shaming maps for what your nervous system is doing and to show you how to bring that into therapy or journaling. My name is Colleen Newbury, and I'm a licensed marriage and family therapist, certified clinical trauma professional too, and I'm also a trauma survivor myself. Trauma Science Academy is where I put trauma and nervous system concepts into plain language for survivors, clients, and therapists. Just to be really clear, it's not therapy, it's not a crisis line, and it's not medical advice. What it is a place to get short explanations of trauma responses: fight, flight, freeze, and fawn, appease, simple maps of nervous system states, ventral, sympathetic, or dorsal, and language for things like people pleasing, shutdowns, and overreactions that actually makes a lot of sense in the context of what you've lived through. If you're here as a survivor or client, a simple way to use TSA is to start with the free one-page guides on trauma responses, nervous system states, and fawning. Read them slowly, highlight anything that feels true, and then grab the free nervous system check-in mini journal through the email list. Use it a few times a week to notice, am I in ventral, sympathetic, or dorsal right now? Bring what you find into therapy or a trusted relationship. You're allowed to hand your therapist a page and say, this feels like me, can we talk about it? You don't have to do everything perfectly. Even having words like sympathetic or fawn instead of I'm too much is already meaningful work. If you're a therapist or a helping professional, you're welcome here too. Therapists have been using these materials to print the one-page guides as handouts in session. Invite the clients to use the nervous system check-in mini journal between sessions. Use the Trauma Science Foundation Starter Pack as a shared language map when you're introducing trauma responses and nervous system concepts. Now, you don't have to be a trauma specialist to use this. You just need a willingness to talk about trauma in clear, non-pathologizing language and to respect your client's pace. So right now, there are both free resources and one small paid bundle. The one-page guides and email mini journal are free. The Trauma Science Foundation Starter Pack is a low-cost PDF bundle for people who want a bit more structure and depth. I keep it small and affordable on purpose. It's accessible to both survivors and therapists. And again, just to say it out loud, Trauma Science Academy cannot respond to crises, and it does not replace your own therapist, doctor, or support team. If you're in crisis, thinking about harming yourself, or in an unsafe situation, please reach out to local emergency services, a crisis line, or a licensed professional in your area. You deserve support that can respond right now. If you'd like to start exploring, there's a Start Here link in the description that takes you to the free guides and mini journal. Take what's useful, leave what isn't, and go at the pace your nervous system can actually handle.